Directly with maternal care, we have also set up a number of waiting homes. So when somebody is due for delivery, instead of them waiting in their village and then trying to get to the hospital when they go into labor, we encourage them to come to the hospital earlier, but they're not going to be hospitalized per se. There's a special home that we have built, and so they will stay there, and when they go into labor, they come across to the hospital. These waiting homes are generally in the compound of the hospital, so you don't have to go very far away. And after giving birth, you go back into the waiting home, and when you're comfortable enough, then you go back to your respective community. So this is something that we have been implementing, and next to each of our major hospitals in the interior, we have been putting up these waiting homes, and I think it has worked remarkably well because we are seeing more deliveries happening in hospital, and we're reducing the complications due to these deliveries. And we have several programs that we've been working on and training people. So one program is that you can have maternal deaths if you have bleeding after delivery of the baby. And so we have a special program where we've been training all our staff to look out for these signs and symptoms and then teach them what they can do to prevent bleeding. We also have another program because part of the challenge sometimes is that people would have, the pregnant women would have eclampsia, which is high blood pressure. And if you don't manage that well, it can lead to all kinds of complications. So that's another program that we have to detect these things early and to manage them well.